Thanks so much. It's a pleasure to be here and to be able to talk about ASAP, its agenda, and the MDGs. Can you hear me? Yeah? I have no visuals apart from myself, so I hope that'll be enough for you. As we just heard, the MDGs are about to expire in a couple of years. There is a discussion underway to understand what MDGs 1.0 did well, what they didn't do well, and what MDGs 2.0 should look like. The retrospective views on MDGs 1.0 include many of the suggestions that you heard from Thomas and Gilad. There may have been a misspecification of some of the targets and goals. The process was not particularly inclusive and participatory. There was an absence of accountability in their implementation. And there was, in addition, the fact that a number of important social goals were missing from the list. Climate change, human rights, governance. We heard something about cultural preservation earlier, a wider view of feminism. All of these things are on the table, and people are talking about what should be added, how we should do it differently, both in the process and in the accountability, and what the numbers should look like. Now, to me, it's quite striking that these discussions of MDGs 2.0, for the most part, are talking about the content of what the MDGs should be, as well as the process that leads up to them. I think it's also important to talk about the form. And what I mean by form is the following. The MDGs were partly a new conception of development, forwarded to some extent, stand as an alternative view to the Washington Consensus. But they were also, and Sakiko has written about this, an incentive scheme. They were designed to incentivize countries, the world, individual actors, private actors, do certain things along the dimension of human development. Now, the incentive scheme was, as economists would say, low-powered. It relied on interagency cooperation, goodwill, a little bit of naming and shaming through reports, monitoring, some data. It wasn't a hard incentive scheme. It wasn't like high-powered incentives. This is related to the accountability discussion that we just had. Now, I think what I want to emphasize is that for the reasons that I will elaborate in a couple of minutes, a low-powered incentive scheme for this kind of agreement is inevitable. It's likely to be the case for MDGs 2.0 as well. We need to accept that and incorporate it. Now, given that you have a low-powered incentive scheme, it's not the case that all low-powered incentive schemes are the same. Some have more salience, some resonate more, some motivate more than others. If you don't believe in an afterlife, the 10 Commandments are a low-powered incentive scheme. They sort of work. Some other kinds of low-powered incentive schemes don't resonate. And what I want to emphasize in the next few minutes is that we need MDGs that nudge. And you may know the book by Sunstein and Thaler, which describes how even when you have low-powered incentives, you can structure the choice architecture in such a way as to promote socially desirable objectives, using opt-outs rather than opt-ins for retirement savings, for instance, is one of their key examples. Now, that motivates private behavior, and the MDGs are partly about public behavior, so it's not exactly the same. Nevertheless, I think we should think seriously about salience when developing these indicators and targets and goals. And we should think about MDGs that nudge. And so I want to, in the next few minutes, make that argument in 3 steps. First, I want to talk about what the MDGs were. Second, I'll say something about what I think is their best analog, which I think are the international human rights treaties and agreements. And third, I'll give you some examples of nudging. So what were they? It's actually easier to say what they were not than to say what they were. They were not a treaty. They were not a formal international law instrument. By that, what I mean by that is that they didn't pass the test of what international political economy scholars talk about when talking about legalization in the international sphere. You have a legalized international regime when you have obligations, delegation of authority to supervise the obligations, and precise actions. I think the MDGs failed all of those tests. There were no legally adopted obligations in the sense of a treaty. There was no process for accession, ratification, no process for reservations, nothing about withdrawals from this treaty regime. That didn't happen. There were no obviously delegated organizations to monitor and sanction failure to reach these targets. We heard something about that accountability scheme as well. Now, a number of agencies did monitor. The World Bank monitors, the UN agencies monitor, country governments, a number of NGOs, but no one entity that was really in charge of monitoring and then especially sanctioning. And then finally, and somewhat ironically, it was imprecise. Ironic because there were these precise numbers, as we heard, cut by half the portion of the world's poor living under $1.25 a day, targets for child mortality, maternal mortality, like the number of slum dwellers whose lives were improved. Despite these precise targets, there was a lot of imprecision, and the imprecision had to do with a number of factors. To begin with, some of the actions necessary to achieve these goals were in the hands of private actors or external actors, and not just national governments. It was unclear whether these targets were average targets for the world or minimum targets for each country. The latter interpretation finally seemed to sway, but it's really ultimately unclear. People talk about it through both lenses. It was clear, as I mentioned, that some actions necessary were beyond the control of national governments, and that there was always an alternative, an out for governments to say, well, we can't really do that. What can we do? The costs for achieving these varied with the baseline level. Marginal costs depended on the baseline level of poverty, the baseline level of mortality and education. There was a mismatch between some of the goals and the specified targets. And then finally, for MDG 8 on global cooperation, it uniquely was not quantified. So for all these reasons, there was a lot of confusion about the clarity and precision of the targets relating to the MDGs. Now, this is true. I think this is unavoidably going to be true. What you need for a legalized international regime is a case law. You need an entity interpreting for you. Whatever targets we develop are going to require interpretation, adaptation, understanding, and not necessarily in a pejorative sense, not the creative accounting that Thomas was describing necessarily, but any legalized regime requires interpretation. And you don't have that if you don't have a delegated entity that's in charge of doing this. So, what are the prospects for getting a more legalized MDG regime in 2.0, in the next round? Not high. The reasons for this is that when IPE scholars look at which regimes around the world, which international law regimes are particularly legalized, they find that there are two things that push for legalization. One is the propensity to shirk. If you think another entity, another state is going to shirk in providing this shared good, you want to watch them carefully. You want to delegate responsibility and monitor carefully. That's true. There is a propensity to shirk in something like this. But it also is more strongly related to the self-interests of the states. And it's simply not the case, in my view, that most states put global poverty very high on their list of objectives. Other things like external security, domestic law and order, economic growth, domestic equity, and identity recognition just figure higher in the priorities of most states. That's not the way we want it to be, but that's the way it is. And we need to incorporate that fact. So, low levels of legalization are likely to continue in MDGs round 2.0. That's point number one. Now, the second point I want to make, the second part of this little talk is about the best analog, which are international human rights treaties. Now, with apologies to some of the international human rights lawyers who might or might not be in the room, these are also not highly legalized. The obligations for these treaties, like the Convention on the Rights of the Child, the International Covenants on Economic, Social, and Cultural Rights, you know the list. These treaties do have formal processes for ratification, for putting in reservations, for withdrawals, things like that. So they meet that obligations test. However, the delegation is given to, although there are committees attached to some of these treaties, the monitoring falls to a number of NGOs, Human Rights Watch, Amnesty International. I'm being sanctioned for my time. A number of entities like that, and none of them have the power to sanction per se. And then finally, what the precision, of course, is quite not entirely clear. Some of the rights conflict with each other. What actions are required are a little bit unclear. I can say more about this in Q&A if you like. So if you buy that, the international human rights regime is the analog, then you have to think about, well, how does the international human rights regime work? Now, we don't think it's useless, and there are studies, econometric studies that look at the impact of ratification on contemporaneous measures of things like torture, child vaccination, and find that, in fact, it does have an effect. These, I've done some of this work. Some of the most comprehensive work is by Beth Simmons at Harvard. So we know they have an effect. We also know in a more qualitative way that these treaties affect mobilization. Some of the language of, say, the Universal Declaration of Human Rights shows up in the Constitution of South Africa. So they affect people. Now, they work through three mechanisms. One is through bureaucratic entrepreneurship. Two is through the judicial application of these treaties at the domestic level. And third, most especially, through social mobilization. So even though they don't have a lot of legalization, they operate through these mechanisms. Now, why is that? It's because they have a lot of resonance. If you think about the constitutional revolutions of the 18th century and 19th century, if you think about some of the work that Lynn Hunt has done on the sort of the artistic experience of the person and individuality, there's a whole global memory of what human rights means. So every time you see a report that uses words like torture or dissidence or human rights violation, there's a global memory that it's drawing on. The MDGs are not like that. They're much more technocratic in their targets. And for that reason, it's not terribly surprising that they didn't necessarily achieve their results. Of the 21 targets, only less than 2, maybe say 2.5, are likely to be achieved. But that's not to say they didn't have some effect. They led to more talking. They led to more aid flows. They did some mobilization. That's what they can do. My point is that the only thing the MDGs can really do is mobilize. And and often the lamentation is, oh, it's just talk. But what I want to say is, I'd say in Silicon Valley, that's not a bug, it's a feature. And we need to take that feature seriously in the MDGs app. Okay, so nudging. 3 kinds of nudges, right? Psychological salience, moral salience, political salience. On psychological salience. Daniel Kahneman, in his book, Thinking Fast and Slow, Reviewing the Evidence, makes the point that facts and data that are cognitively easy feel familiar. And things that are familiar have the ring of truth, even if on careful demonstration they're not true. If you take that seriously, what we should do is think about things that are relatively easy to understand. So for our targets, let's get rid of the large numbers, let's get rid of the proportions, things like that. MDG 8, as I mentioned in global cooperation, did not have any quantified targets, but people often do talk about the 0.7% of GDP that countries ought to be donating in ODA. Now, do you really know what 0.7% of GDP is? Does your mom, does your aunt, does your uncle? How big a deal is it if it goes from 0.6 to 0.7? Does that mean a lot to you? Not obvious. So what I think we should do, for instance, we should do something like share of tax dollars per person in each country that go to ODA. $20 per person in the United States, $130 per person in Norway. You can compare that to your other expenditures. That's the kind of thing I mean by psychological salience. Infant mortality rate. Do you know what that is? Is going from 300 to 280 as big deal as going from 30 to 10? Do you have a feel for that? Maternal mortality ratio. Why is it a ratio and not a rate anyway? And why is it deaths per 1,000? Is it 100,000? Do you remember that? I don't think these numbers have a lot of salience. For the health indicator, we need something like lifespan, right? you have a feel for how long people live. That could get people talking. Now, we can talk about life expectancy. Life expectancy is more technical, and it emphasizes the early years of life. We could have a weighted average over all demographic cohorts. There are ways to sort of, to sort of develop what an average lifespan, the lifespan of people who are currently living. We could use that. So that's another idea. Carbon emissions. 1,000 metric tons of carbon dioxide equivalent emissions. Do you have a feel for that? I don't know. But even 2 degrees centigrade, does that seem like a lot to you? It doesn't seem like it's a big difference in temperature. So how about millimeter increase in sea level? That's something you can feel. In addition, it embeds within it the causal narrative about why carbon emissions might be bad. There are others I can suggest. Universal literacy, I think, makes sense for education. Now, causal narratives, I think, are also crucial. I'm going to take a couple more minutes if that's okay. Causal narratives are also crucial because people need stories. The MDGs were just a list. Now, when it comes to causal narratives, when you ask people what they think about development, what they think about, most people, according to a study by Darnton and Kirk, is corruption. That most people think that development isn't working because of corruption around the world. And the MDGs need to take that on with, I think, a transparency corruption indicator so as to confront it directly. Let me quickly run through the other points because I'm just about out of time. By moral salience, what I mean basically is the idea that if you think about the big moral revolutions, abolition of slavery, decolonization, Appia talks about foot binding, these are about saying no, right? And Gandhi, for instance, developed non-cooperation, was very good, very insightful about the importance of saying no. He said, rejection is as much of an ideal as the acceptance of a thing. It is necessary to reject untruth. It is as necessary to reject untruth as it is to accept truth. We had lost the power to say no. So we should construct these as saying no. Now, Thomas makes the argument that morality itself has higher standards for action when related to not harming than to doing good. I don't necessarily want to make that point, but I do think it's certainly more morally salient. So we should write these in words like avoid further impoverishment of the poorest people in the world when it comes to trade barriers. Stop exposing the world's most vulnerable to droughts, floods, and storms. Release all information that helps people make economic and social choices for themselves. Avoid saying no. And finally, political salience. The MDGs were developed outside the state system. It's states in the world that have much more legitimacy than the international civil servants. And we need to draw on them to develop these targets. So the idea here is to say to states, come up with your own targets, ratify them. But if you don't, we'll use the international targets. So there'd be a default for them that would be used otherwise. And the idea here is built on the fact that ethical argumentation to be accepted depends on getting into a good venue and on the legitimacy of the person talking. And it's states much more than people like world bankers who have legitimacy in the eyes of most of the world's poor. So there are a lot of things that we can't do to generate generosity and empathy in the world. Self-preoccupation is a failing of human nature. But there's certain things we can do, like making the targets less technocratic, like making them more morally salient and making them more politically salient as well. Thanks.